Good afternoon. Happy Saturday. I am Dr. Holda Gay. If you're just tuning in, you just kind of rolled onto this live stream. Welcome. Welcome to the Becoming Yourself YouTube channel. Maybe you listen to the Becoming Yourself podcast that I have as well, or maybe you're just completely new and you saw the title of this live stream and you clicked on it. Whatever the situation may be, I warmly, warmly extend my welcome to you. I'm a physician and a certified coach. I work in women's health. I'm a board certified OBGYN in the United States, specifically in Columbia, Maryland. If anyone's looking for a new OBGYN, you can look up visionarywomenshealth.com. I'm happy to welcome you into our Visionary Women's Health family. And I'm also a coach. And that journey started in a very interesting way. And it really started when I began to notice certain patterns. I noticed that when I healed myself and became my true authentic self, that my body also healed and all of my health issues that, even I as a doctor couldn't fix and my brilliant physician colleagues couldn't fix just kind of left. And then I started to apply the similar principles and connections I was making to my patients, and also started to see the amazing shifts that they were getting as well. If you go on my YouTube channel, you will see the link to the TEDx talk that I gave on this and the data that I presented. And I'm very blessed to be able to work with clients and patients in a way that not just heals their body with traditional Western medicine, but also heals their mind and awakens their soul. So I call myself a self-realization coach because what I do is I awaken you to who you truly are. I help you shed everything that doesn't belong to you, all the identifications, the beliefs, the emotions, and the traumas that have tainted your light and aren't allowing the full power of your consciousness and the purity of your light to come through, which is at the root cause, in my opinion, of your physical ailments and the ailments in your life, your relationships, your finances, your career, the feeling of being stuck in any way. Because once you start to really shine your authentic light, you truly become unstoppable. But most importantly, and this is what was most important to me, happy, and you find your inner peace. So this masterclass, this mind-body connection, really is just about showing you how you can infuse this teaching, this self-realization to your journey towards health. And maybe it's not physical health that you're looking for, but you're looking for health in your life. And this will also give you that as well. So welcome. I'm very excited to dive into this. And at the very end, I am going to take some questions. I already see that I'm getting some questions that are being submitted. So depending on how much time we have, I'm going to try to go through as many of them as possible. Whenever I do something like this with my coaching group, the questions tend to be really big and deep. So even if I don't get to your question today, just know that you will still find benefit from hearing the answers to other people's questions, because believe it or not, we all have very similar problems, and it may be different names, different places. But generally the core problem tends to be something that you can also relate to. So stick around, put your questions in the comments, and we're going to try to get to as many of them as possible. I'm also doing a giveaway. So for everyone that puts a comment, and if you don't have a question, you can just put giveaway as your comment. We are going to randomly select anyone who puts a comment to get a free membership into my Inner Circle platform. And this inner circle is where the journey for self-realization also lives. So you'll get a year's free access to the self-realization journey that you can go through at your own pace online, and it truly will change your life. I have not had anyone go through this and hadn't had miraculous things happen to them. I took myself through it before I put it together and delivered it to patients. So I'm happy to give one away. It's going to happen every single time we do one of these live master classes. And all you have to do is put a comment, and we're going to randomly select someone to get free access for an entire year. If you just want to go ahead and join the inner circle, you will find the link in the comment as well. You can join just the self-realization online journey, or you can join the community where you'll find some other mini courses as well, and a group of people just like you on a similar journey. It is a supportive and warm place, a safe place. So if you're interested, you can go ahead and check out the links. So let's get started. I want to start from the very beginning because many of you probably have never heard of this, or have even really been really taught how to use the healing of your mind and of your thoughts and your emotions, and of awakening your divine soul signature to complement traditional medicine, or to really help you heal. Now, I run into different kinds of people. I run into people that will tell me, "Oh, that's all too woo-woo. Just tell me what the diagnosis is and what prescriptions I need to take." And that's fine. I think we are all on different parts of our journey, and what you believe is going to be what helps you. So if that's where you are, that's okay. I'm just inviting you to look at some of the science and the data that's going to show you that your thoughts and your emotions and your beliefs are not some sort of separate woo entity, but are actually intricately linked to this physical body that you are living in. In fact, you have probably experienced times where you had a fight with someone and you began to have this really strong headache, and you could feel it in your body. And as soon as all the stress from that fight went away, the headache disappeared. If you start to look at things in that way, you'll see that we don't have these compartments that separate your thoughts from your body, from your heart, and all of the stuff. It's all one, and everything affects everything, right? When you're laying at night and you're thinking, and you can't fall asleep, well, your sleep centers care that you're thinking. So it's all related and connected. So if you can just open yourself to that, you're going to do great, and you're going to be able to benefit from what I'm going to teach you today. And then I have the flip side. I have my super spiritual folks whom I love, my holistic, they tend to be my holistic vegans, I call them. Not all of them are vegan, of course, but they will, these are the group of people, and this may be you listening, who think, I'm here because I want to eliminate all prescriptions and medications. I don't want to take anything. I know that I have the power to heal myself, and I just want to do that from a spiritual standpoint and with the power of my mind. And you're ahead of most people. That is, I think, definitely where we are heading to as humans. But I also want you to realize that you are starting a war with with something that we know also can help you, right? Because if you now say, well, Western medicine is bad and prescriptions are bad, and I will never want to touch that, then you've now created a resistance with something that has the potential of helping you in specific situations. And you're just not going to have the full access to everything that could potentially change your life if you think of it in that way. Now, that doesn't mean that you have to now start going to take prescriptions. It just means that you are in the perspective of, I'm open to whatever it is that I need right now, and I'm open to following my guidance to discover what that is. And if you're in that spiritual camp, you know exactly what I'm saying. If you're having a heart attack, I want you to go to the hospital. I don't want you to sit home and meditate unless you have gotten to a consciousness where you are so certain that you're able to undo the physical manifestations of that heart attack. But most people listening aren't there yet. So, to sit home and say, nope, I'm not going to go to the hospital because they're the devil and I'm going to try to fix it on my own, is closing yourself off to something that could potentially help you. Going to the hospital and getting help and getting that immediate care you need to open up those vessels so that your heart can start to function properly again is not anti-spiritual. Again, your body and everything that we have created to help our body along this full spectrum of humanity and of creation is all open and accessible. So you'll find as you watch and follow me that I don't put things in buckets of good or bad. It's all about, what do you need right now? What do you need right now? And so you'll hear me say, just like I did in my TEDx talk and to all of my patients, that I will never say that I'm anti Western medicine or traditional medicine. I embrace creation and I embrace everything that's in it because it all has a purpose, all of it. Nothing was created by accident. So I employ Western medicine where it's appropriate. I embrace, I have a certification in herbal therapy. I have a certification in functional medicine. Like I said, am an inner healing coach. So I really, truly love everything that has been created for the purposes of healing, because you will find gifts within it. And all of it isn't for everybody, and everything isn't for you at different parts of your journey. So I just want you to basically come into this with a big, wide open mind. And if you can do that, you are going to do so much better than someone who just has this stance of, this is bad, that's bad, that's bad, and here are the only things that I'm going to do. Okay. So let's get right into um, um, how and why does self-realization even help you? And what is possible when you combine these mind-body principles to traditional medicine? Um, we know, whether you have seen the data, and there's research that shows that your emotions, your emotional state affects your body and therefore can affect your health. Now, there is data in the neurobiology work, chemical sciences. There's a lot of good, very fascinating information that shows that your emotional state changes your chemical makeup. And that chemical makeup can either interfere with processes that are meant to help your body function properly, or the opposite. They can enhance your healing properties if you're in sort of this good feeling state that allows your body to do what it needs to do. You may have heard of the fight or flight response, which is the sympathetic nervous system, versus the rest and digest response, which is the parasympathetic nervous system. And it is in the fight or flight, again, there's no good or bad. The fight or flight response is sort of what we think of as a stress response, and it has its role, its benefit. If you're trying to activate all of your muscles and move as fast as you can so that you can run away from a falling building, you do not want to be resting and digesting. You want this fight or flight stress response to be at 100, 200, right? So it has its role. But when you're in flight or flight and you're trying to fall asleep, and then it's a problem. Or if you're there all the time, then it's a real problem. That's when your body's really going to start to break down, and you're going to start to have chronic issues. Versus rest and digest is where your immune system can really start to clean up and kick in. If we know also your immune system, the antioxidant portions of really restoring your body are even higher when you are fasting, and can also be in sort of that calm, resting state. So everything, again, all parts of us have their function, but we have gotten into this imbalance where we are either constantly in the stress response or we have daily negative emotions, negative meaning that they interfere with our balance and weren't designed to be there all the time. And I'm talking about sadness, anxiety, overwhelm, fear, doubt. This is sort of the day to day life for many, many, many people that I know. And that daily experience is going to erode at your health and, of course, at the health of your life. So, if you're interested in the data, I'm going to try to put some links so you can go in and read the papers that link these emotional states with your health. It is clear as day. You can't question it. And you've probably had experiences where, so for example, I'm going to give an experience for genital herpes, where one big trigger is stress. When patients are stressed out, they get an outbreak, and that's because it has weakened your immune system enough that now the virus is going to come out and manifest as sort of a very opportunistic virus. And there are many examples of this throughout medicine. And these are things that we know as physicians. And so we generally say things like avoid stress, don't be stressed, but most people don't know what that means. And part of what I do is to help you apply that guidance in a way that is effective and it will actually translate in an improved health and better life for you. I take this a little bit further than emotions. What I found was, and I started asking the question, well, what dictates our emotions? Well, our emotions are generated moment to moment from or by what we believe and identify with. So, this is the stories we tell about who we are, what our life is, and what everything around us is about. This is the meaning that we give to things. And of course, all of that can come from past events and traumas or the culture you are from or how you grew up. But ultimately, it comes down to what is it that you are believing right now? What do you believe in right now? What do you identify with? And that's going to generate your current emotions that basically will dictate your thoughts, your behaviors, the state of your health, and the state of your life. And so I created what we call the matrix of transformation that looks exactly at that. You know, therapies, when you go to therapy, they want to know, well, what happened to you that created this, which is a great question to ask. But what I think is a more important, more effective question to ask is what beliefs and identifications did you draw from what happened to you? And it is those beliefs and identifications that are creating your current experience. And it never fails. And when I started to do that rather than chasing the emotions and the thoughts, the outcomes were miraculous. And I'm going to go through actually a few patients. I have hundreds of recorded cases that I started to track over time. And I'm going to just give you some examples of some recent ones that occurred so that you can also see what's possible for you and that this isn't just some other, very vague general statement about wellness and have less stress. This is actual um, changes that can really make the difference between you being stuck and struggling with a health issue or an issue in your life and no longer being stuck. So maybe let's go into that since we're running up on 19 minutes already. So let's talk. I'm just going to kind of give you a couple of examples here, and I'm going to go with recent ones because they're fresh in my mind. But like I said, I have hundreds of them at this point since I started doing this work back in for a while now. It's been maybe about 6 years now that I've been coaching on self-realization. Let's see. So there was a patient that I actually followed up with, and I'm going to try to keep these very vague. So you're not going to know who I'm talking about. I'll tell you sort of the illness and the change, but of course, I need to protect the patients. So I unfortunately I'm not going to be able to go into so much detail that you could potentially guess who it is that I'm talking about. This patient had something called Ehlers-Danlos syndrome. Many of you probably have never heard of this disorder, EDS, because it's rare, but it is also one that tends to take a long time to diagnose because a lot of providers, believe it or not, aren't familiar with it either. And it causes a lot of disability. It causes issues with joints and pain and connective tissues and the immune system. And so the symptoms go across all the different organs and parts of your body and can be very confusing for physicians to put together. And one of my specialties is the gynecological manifestations of EDS and how to help patients with EDS with their specific issues. And because I trained at Johns Hopkins and this was something that came up sometimes in our clinic, I realized that this was a big gap and I wanted to help patients with EDS navigate their GYN issues. And so I just took some extra time to teach myself and to learn and to read as much as possible, to learn from those who knew how to treat this. And so I have a lot of patients with EDS. And most recently, one of my EDS patients basically shared with me that she has not had, so she used to have just severe pain all over her body, especially in her large joints. And she would get sort of these rashes. And she has not had one for 98 days. And then as soon as she kind of went back to her ways, and I'm going to tell you the changes that we talked about that she made, she started to notice that some of the pain and the rashes were coming back. So she kind of backtracked again, and then she's back to her stable state. And what the work that we did together was, and this is very common with patients who have been sort of sick their entire lives. They were sick since they were little. They were going doctor to doctor. They were always had this attention from adults. And we talked about changing the story of who she is. She had this identity that she's just someone who's always sick. She's sick. She's broken. And her body just fights her all the time. Her body isn't in cohesion with what she would really like it to be. And that was who she was. And so I gave her a simple exercise, one simple exercise. And that was that I wanted her to focus on her good days, on the days where she didn't have as her symptoms weren't as bad, or maybe she didn't have any, because she did have those days. And I want her to begin to tell the story that that is actually who she truly is, that the days where she is feeling great is truly her her equilibrium. This is at the baseline of who she is. And those days where she's having pain, it's just a fluke, and it's a fluke that's been kind of happening a lot, but no big deal. Her identity is now someone who actually is well, and that her body is constantly trying to return to that equilibrium, to that balance of someone that is well. And only with that exercise, she didn't start all of the other sort of processes that we go through in the self-realization journey. She started to notice that she was having less and less flares, that her pain was going away. And this is an internal job. This isn't just like, a technique that you're going to do or recite or just think about occasionally. This is really about going within and asking yourself, who would I be if I didn't believe what I currently believe? Who would I be if I believed this new thing? And that's what she did. And she put in the effort to do that and felt, the first thing she told me was, I just felt free. And that freedom from believing that she's this sickly, broken person to actually she's a healthy person and her body knows what to do and is trying to find balance and will find balance, gave her a symptom-free 98 days. And what happened at the day 98 was she asked herself, well, is this really real? is this just like a fluke? Or like literally, these are the words that she used. She was laying in bed and just kind of wondering, like, what if this was all just like a coincidence and an accident, and it's not going to stay. And what she was doing in that moment is her brain was saying, well, what if I'm not somebody who is well? What if I truly am sick and this was just a fluke? And in the moment she did that, she began to notice that her soreness was returning. This isn't a joke, guys. This is real stuff. And this is not magic, right? What you are thinking and feeling is affecting the processes in your body. Your body is listening. Your body is holding on to your emotions, and will manifest it in different ways. Right? Again, goes back to the example of the fight that you have, and then you get a headache. Your body is very closely connected to everything that's happening in your mind, in your heart. Right? We are all one. It's not fragmented like we have been taught to believe. And so she realized that, good for her. She caught herself and she went back and she just told herself, nope, this is like, I'm not going there again. And she's doing well again. And we're going to continue working on now. She wants to do a little bit more so she can really start to get to the bottom of other things that's happening. But this is an example of how that mind body connection can help you. Another example is, and I'm going to try to give you different ones. I wrote down a few here, but this was a patient that had basically some autoimmune symptoms that no one had a diagnosis for. She would randomly get joint swelling that would come and go. She was always very tired. She would gain a lot of weight and then lose the weight. She had some digestive issues, and she had a battery of tests and nothing came back conclusive. So basically it was, we don't know. She was getting steroids here and all these drugs that would maybe help a little bit, but nothing was really resolving. And I asked her, do you want to give this a try? Would you like to take a journey with me to see if there are things that perhaps are alive in your sense of self and in your beliefs that maybe are creating these chemical cascades downstream? And she said, yeah. And we worked on a few things, but within the first thing that I identified, and what I generally do is I first just have a conversation. And what I'm doing is I'm identifying where the identifications and beliefs that can be causing disease or be causing the issue that you have in your life are. And then we start there. So the biggest one that came up for her was a father wound. It was glaring. And so we just decided to work with that first. And I had her do a morning meditation practice, and we started to work on the beliefs and the perspectives that she had around what happened to her with her father and everything that she was basically recreating every day. And her symptoms went away, all of them. She no longer had the joint swelling, and this happened. So we were working together. We had a few sessions together. So I would say they were separated weekly. So we probably had 3 sessions together. And we had a follow-up a month later. And this was because we had a medical follow-up, which was different from the coaching sessions. So from the first time we spoke to this time where she told me all her symptoms were gone was about a 2-month period. And she told me she no longer was having joint swelling. She was no longer having the digestive issues, that everything just disappeared. And she realized, she's the one who said to me, wow, my father was really messing me up. But I said, no, your father wasn't messing you up at all. What messed you up was the stories you were telling yourself around what happened to you, right? Because somebody else could have gone through the same thing and come up with very different conclusions. The question is, what stories are you telling yourself every single day that are creating your identities and your beliefs? And how is that messing you up? So that was beautiful. I loved that. Was just amazing to hear. I have several infertility ones here, lots of patients who struggle with conceiving. And that's such a common one. And often, as many of my reproductive endocrinology friends will tell you, um, that infertility is one of those very taxing struggles that we have in our current society, because there's this expectation that as women, we are supposed to bear children, right? And when you have the desire and then it's not happening, you feel almost like your body's betraying you. And so there's a lot of like internal fight that happens. And this process of releasing these stories and these false identifications and beliefs is very powerful in that specific situation. And I have many that I have written down here where just going through that process allows them to finally conceive. I have more that I've written here, but again, for the sake of time, I am going to just briefly kind of maybe talk to you about what the matrix of transformation looks like so that you can start to apply. And I'm going to give you an exercise that I want you to do to start to see how you can make these shifts yourself. And then we're going to take some questions. So, the matrix of transformation, and I'll just try to see if maybe we can, I'll put a link somewhere so you can see the diagram, but you can also see the diagram in the TEDx talk. What I noticed was that all of your symptoms sort of lie downstream, right? So if you're looking at a spectrum, so if you think about all of your current symptoms, whether it's in your body or in your life, it could be, I can't find the relationship that I want, or I'm having financial issues, whatever that the issue is, those symptoms are downstream. So that's what your experience is. And often, what we generally do, and we are stuck in a place in society where we are told, okay, do this. Here are the behaviors you should implement so that you can fix this experience. So, for example, this will be, if you're overweight, you'll be told just go exercise and eat less. And we all know how that goes, right? It doesn't work, right? I mean, it should work, but why doesn't it? Well, you'll know because there are things upstream that are not being addressed. And this is with many other things, patient once told me that her mom told her that she needed to socialize more so she can find this man of her dreams. We're very much stuck in like, go and do this to fix your experience. And that will work sometimes because that behavior will be aligned with everything that I'm going to mention in just a second. But when it clashes, that behavior won't get you anywhere. So what is upstream? Well, those behaviors are dictated by thoughts, right? You have to think certain things that are going to align with that behavior. So if you are going out and socializing to meet new people, to find your soulmate, but your thoughts are, oh my God, I hate this. This is not going to work. I don't want to be here. Nobody likes me. Everyone's looking at me weird. That socializing isn't going to work out very well for you. But if you can align the thoughts so that it's matching the intentions of why you are socializing, then socializing is great. And that's the thoughts. That's the next one up in this matrix. But even more powerful than that, and kind of going up beyond that, are your emotions. And this is where we've made so much progress, and you'll find a lot of people will talk about how an emotional body. You'll hear people talk about how to heal the emotions that are stuck in your body. Somatic healing is about releasing the emotions in your body, and it is beautiful. It's amazingly powerful. So again, if these emotions contradict those thoughts and those actions, that's where you don't really get good results, or your results are very inconsistent. But where did these emotions come from? Why is it that you wake up every day feeling overwhelmed and anxious, right? They are coming from beliefs and identifications that you have. So you have things that you believe and identify with, an entire story that are generating these emotions. So yeah, something may have happened to you 10 years ago, But an alien would come down and say, dude, that was 10 years ago. Why do you feel this way today? You feel that way today because you have a story that has generated a sense of identity and beliefs that are creating these emotions still today. And this was my breakthrough. This was what I found was sort of the next level for healing, not only for me, but for my patients. And that's why I created this diagram, this matrix, because I don't want to get stuck with working on your thoughts. I don't want to get stuck with only talking about behavior. I want to talk about how do we shift your identifications and your beliefs, because that transformation is quick and creates miracles. When you work there, everything downstream changes. You don't even have to tell yourself to change your behavior, it just happens. When I used to be overweight, and I just changed my story around who I was and didn't identify anymore with being overweight. I didn't have to tell myself to eat less. I didn't have to tell myself to exercise. I just wanted to do those things because now my identity shifted from someone who's just always who's a fat person who just um, is never going to lose this weight, to someone who's actually fit and healthy and uh, loves and enjoys good food that's good for me, who loves to nurtures herself. It all flows once you get to the source, which is what are you identifying with and what do you believe? I take self-realization a little further and allow you to see that this is where your creative power lies, choosing what you identify with and what you believe. But who you truly are is actually much bigger than that. Your soul signature is what is choosing the avatars that have identifications and beliefs, but that's for another day. But this is powerful stuff. This is stuff that um, just gets out of the realm of child play. Like if you're really serious about changing your life, this is where you go. This is where you go. So, what I want you to do, your exercise today is you're going to pick just one thing, pick one problem that you're facing. If you want it to be a small problem, go ahead and do that. If you want to just go ahead and tackle the big problem in your life, the elephant in the room, go ahead and do that. But pick one problem. And I want you to pretend that this is a problem that a friend of yours has. And you're going to ask yourself, you're going to write this down. What beliefs would they need to have to have this experience? What beliefs would they need to hold to have this experience? So let's say, for example, you picked a chronic illness that you have had since you were little. Some of the beliefs may be, I have always been sick. I have a genetic disorder, so therefore I will always be sick. Therefore, my body's broken. Some people have said to me, I am cursed. Or I get attention, I get treated better when I'm not doing well. Whatever that is, ask yourself, what are the beliefs that I would need to have or that they would need to hold? Whichever one works easier for you. I find it's easier sometimes to start thinking about it with someone else. And then as you get really good at that, you can start to bring it to you and just find what are those beliefs that you're holding that you would need to have to create this experience. And as you identify things, just ask yourself very honestly, quietly, no one's listening. Do I believe this? And so you're just going to start there and watch how you will start to see beliefs that are anchoring this experience for you. And that is the beginning to healing them. That is the beginning to healing them. And that's what we do in this self-realization journey. That's what, I do with patients that want this kind of coaching and guidance. But this is going to be the beginning for you. So take the time to do this exercise. All right, so we are over our time, but I'm going to try to see if I can take one question. So let's see here. All right, I'm going to take this one. This looks like the first one that came through. All right, and maybe I don't think I'm going to butcher this name, so I'm not going to say the name or the username, I guess. It looks like it's a username. The question is, I have been going to therapy for 12 years now for something that happened to me when I was 8. Okay. I know that it's I know that it is the reason why my relationships never end well and why my health is worsening. Okay, good for you for making that connection. I still get nightmares though sometimes, but not as often as I used to before I started therapy. What can I do if I have been trying to heal this for 12 years? Oh, this is a great question. And I want to just first tell you that you are not alone, that many people tell me that something happened to them when they were little. And, they finally had the courage to go through therapy. So they identified that that was the source of sort of their current state or current active issue that they're having. So I want to first honor you for having the courage to go through that process, for sticking with it for 12 years, and for identifying that and making that connection. Um, the first thing that I'm going to tell you is that, again, just like I mentioned earlier, that I don't um, I don't believe that certain things are bad and other things are good. Some people will tell you therapy is useless. Don't go to therapy. I don't believe that at all. Just like you were able to make the connection between what happened to you and what you're experiencing now, that's an amazing gift that you got from therapy. But you're now at a point in your journey where what therapy is doing for you and this specific therapist or therapy that you're going through, and I have an idea of what kind of therapy it is. What it's doing for you is it's rehashing your story around what happened. You've identified it, and now you have this story around what happened to you and what it means for what's happening to you now. Okay. And I know it's still alive in you because of the way that you asked the question, because of the fact that you're still having nightmares. You were able to identify it, but you never took the next step, which is this event, this thing that happened to you created specific beliefs that were designed to protect you at the time, that it's now time to release them. So, I would love to have a conversation with you so that we can unfold and uncover the beliefs that you created about who you are, the beliefs around the world based on what happened to you when you were 8. And it's when you take those beliefs and you challenge them head on and realize that you don't have to believe that anymore, that there are other perspectives. There's another way. There's another gateway. Your soul is asking for another way. Your soul is asking to come up with a new truth for you. That's when the nightmares will stop. And that's when your relationships will change. That's when your health will shift. So it's time to stop rehashing the story. You've identified it, you found it. Unfortunately, many of the exercises that you're probably doing right now in therapy are stuck in the realm of your thoughts and behaviors, right? They never go upstream because its goal was to identify what happened, and you did that. But now it's time to stop rehashing it for 12 years. So if you can do that, if you can perhaps go through this exercise and see if you can come up with some of the beliefs on your own. And you can start to see where you're still stuck. And when you make that shift, when you heal those beliefs to ones that are more in line with what your soul is asking for, then you will heal. Guaranteed. All right, guys, we have gone over. I see that there are some other questions coming in, and I'm going to save them, and we'll definitely come back and we have some more of these masterclasses coming up on YouTube. So make sure you subscribe, hit the notification button so you can see them. Make sure you put a comment, because I am giving away a year's worth of a membership into my inner circle so that you can go through the self-realization journey online with me and a community of people just like you. I'm sending you my deepest and warmest love. And I want each and every one of you to know that you are more powerful than you know. You are more beautiful than you can see. And everything that you are searching for and asking for is already in you, that you are the one you have been looking for. It was my pleasure to talk to you today and to be here with you. And I will see you in the next live.